Welcome to the Detox and Nutrition Coach Podcast. The following is for educational purposes only and is not intended to diagnose, treat, cure, or prevent any disease. Please seek the advice of a healthcare professional before changing your health program or embarking on a new one. And now, the man that simplifies the complex, your host, Dr. J. Davidson.
I'm excited to introduce my guest, Dr. Kenneth Stoller, who is an integrative doctor, MD degree, also focuses on hyperbaric oxygen therapy along with infections and brain conditions. Is that the best way to kind of sum up your specialty?
That's a good start.
Okay. So thank you for taking time to do this interview with me, Dr. Stoller. Diving right into it, I kind of want to, so you've been in the medical world for 20 years, roughly?
I think I got my license in 1982.
82, so I'm way off, so that's even more than that. So talk to me about the medical world and when you graduated in 1982, from your mindset then to where you're at now, and what have you experienced through this journey?
Well, when I started, I think there were a lot less people interested in alternative and complementary medicine. And I felt very lonely.
Okay.
And I was told by a soothsayer, if you want to call it, that by the time I was 40, there would be many more people who were thinking the way I thought. I wasn't told they weren't going to be MDs, though, and they weren't. You know,
Okay.
Chiropractors and naturopaths and acupuncturists. But the MDs have remained, for the most part, fairly hooked into the Rockefeller Foundation paradigm that was set up 100 years ago. So not much has changed in that area, you know, with notable exceptions like members of ACAM and functional medicine groups, Integrative College of or International College of Integrative Medicine. There are groups out there, but you know, there's certainly a minority of MDs are involved in functional and integrative medicine.
Okay. So in other words, when you came out, you were already pretty much thinking alternative.
I was never in the box. Okay.
So with what you've seen in the last, I mean, it's 2016, 1982, so we're looking at maybe 34 years. I mean, in the last 34 years, what have you seen as far as from a medical practice to shifting over into the functional medicine becoming more and more popular, even though, I mean, that was something that you've obviously been doing for many years?
We're in a transition period. I don't know how long it's going to take. You have a polarization taking place, controlled, institutionalized, or industrial medicine, which still rules the roost as far as conventional MDs are concerned. And then you have this more individualized, integrative, functional approach, which at the current time is mostly in the hands of alternative healthcare practitioners like chiropractors and naturopaths and acupuncturists. But they don't have the access. Each one is limited to a certain extent. The MD degree is still the most versatile degree in medicine. It's just not being utilized because they're, for the most part, been captured and under mind control, for lack of a better word, by the old paradigm. And I don't think the old paradigm's not going to change.
Okay.
The old paradigm is the old paradigm. It's going to have to basically fall by its own weight, which it will eventually. And for people who are not familiar with what I'm talking about, this is essentially a form of medicine that was set up to sell patentable medicines that could make pharmaceutical companies a lot of money.
And is that what you meant when you meant Rockefeller Foundation?
Yeah,
Okay.
yeah. They're the ones who set up this paradigm and controlled the medical education so that the physicians, the MD physicians, really wouldn't understand nutrition, really wouldn't understand what all their options are. They were always directed and pointed towards selling patented medicines.
For profit.
Of course.
Okay. So when you're looking at the system now, obviously the system is based off of selling patented prescriptions. That's a big problem. What other things stand out where it's like, this is a massive issue. This is also, I think, a big mistake that's being made right now in the medical world.
All right. Well, before I get into that, let me just say, because people are going to go, well, what do we do? What can we do to find the answers that we need? And that's a difficult question to answer, because you really need to find a mentor who can help guide you through, see this person for that problem, see that person for this problem. And these mentors are really only available to people who are very well off and who are not constrained by, in-network, out-of-network providers. If you're stuck in, I have my insurance and I need to use my insurance, you are stuck with that mindset.
Mm-hmm.
So during this transition period, until the new paradigm takes a foothold, and I don't know how long that's going to take to happen, this better form of integrative functional medicine is really an out-of-pocket expense, and if you don't have much in your pocket, unfortunately, you're in a bad situation. And in my book, Incurable Me, I start telling this story about how bad things are using Lyme disease as an example. Here is an illness that's probably affecting at least 20% of the population, and they have no idea they're infected. It's not like getting syphilis where you get this telltale ulcer on your private parts, just in case you didn't know you had syphilis. Here's a nice ulcer. Lyme disease can be very stealth, and you have people like Chris Christopherson who are getting, diagnosed with Alzheimer's disease when it was really Lyme disease all along, which, is a whole other hornet's nest, because there is no Alzheimer's disease. The brains of patients with Alzheimer's disease have a neurospirocatosis. This is an infectious disease, but it's never it's never one thing. We're in the third dimension, so there's always three sides to things. If we weren't all being poisoned by pesticides, people's immune systems would be much more robust and able to take care of these infections. But we're being poisoned, which brings up a whole other issue.
Yeah, well, that then obviously suppresses our immune system, which makes us more likely to get these infections. So talk to me about brain conditions. When you say Alzheimer's, what else falls into brain conditions?
Parkinson's disease, schizophrenia, and these are all, to a greater or lesser degree, linked to pesticide exposures and occult or stealth infections that people don't know they have.
And when you say neurospirocatosis, you're talking about spirochetes basically in the brain.
That's correct.
Okay.
Everybody has spirochetes in their mouth. They're considered benign, and they are for the most part. But let's say you get infected with Lyme disease. Well, this is an organism that has 132 genes. Syphilis only has 22 genes. And not only does it have more genes, and it is a much more sophisticated organism, it has something called plasmids. Plasmids are a loop of DNA that the organism can exchange out in the environment with other organisms. So if you're infected with the Borrelia spirochete, it's capable of taking those plasmids, those DNA messengers, and passing them on to the other spirochetes that are normally benign and that exist in your mouth, all right, making them perhaps much more virulent and able to get into your brain where they don't belong.
Okay. So in other words, plasmids are a way almost of like mating or changing the expression of benign ones that could be. Do you feel like that's a huge link? So from a clinical standpoint, when somebody's quote-unquote diagnosed with Lyme, it seems as if there's always mouth issues. Do you believe that's a big piece of it, or is it more just overall oral health and the microbiome and mercury in the teeth?
The health of your teeth and your gums is a nice benchmark or barometer of how your immune system is doing.
Okay.
So if your mouth is falling apart, the rest of you is falling apart too. But back to talking about the screw up with Lyme disease, I mean, you see what happens in the public media, if 4 people get Zika virus or something like that. We're talking about 50 million Americans. This is the negation of an illness. This is a global pandemic, and it's like we don't even care about it. When the CDC a few years ago announced it's not 30,000 new cases a year, it's really 330,000 new cases a year. And nothing. Silence. Crickets. What's that about? Well, what's it about is no one has any way of making money. And if you really get it into the societal consciousness that, 2 or 3 out of every 10 people in the United States have an illness where we don't have a really great way of diagnosing it, there's no consensus on treatment, there's no test to perform that gives you an indication whether you're cured or not, well, that causes people to lose sleep. And when you lose sleep, you want to grab your pitchfork. And when you grab your pitchfork, who are you going to go after? The people who told you that this is what's going on and it should have been their job all along to be handling it. So it's like, worrying about killer bees when the San Andreas Fault is, fracturing. But of course, bees, that's another thing. Why are the bee colonies collapsing? Pesticides. Glyphosate. We are poisoning, we are allowing ourselves to be poisoned, and we don't have to allow that. The CDC, the FDA, these agencies, we cannot depend on them anymore. They've been bled out from the inside by agribusiness, by pharmaceutical companies. They are not going to help us. We have to take this into our own hands.
Well, it's interesting you mentioned the CDC and the 300,000 or 330,000. I mean, just that statistic alone shows that there's more people each year affected by Lyme disease than breast cancer. And all you hear about in the month of October, pink ribbon, breast cancer, AstraZeneca, sponsored, all that funded. So talking about 20% of Americans with spirochetes. I mean, that's a massive issue. So what are our solutions to that problem?
And since you mentioned breast cancer, we're talking about pollution, pesticide pollution, heavy metal pollution. That's why people are getting breast cancer. It's all coming down to the environment. And it's apparently too big a problem for us to have. We're just going to have to live with it. Pollution is indispensable. Pesticides are indispensable. No, they're not. They're killing people. I mean, and you get news blackouts. I mean, do you hear about the Fukushima killing sea life in the Pacific? You don't hear about that. So, the time to have rung the alarm bells was when an opportunity lost was when the CDC said, hey, it's not 30,000, not that 30,000 new cases is a small number, but 30,000 goes to 330,000. That would have been an opportunity to say, this is a national emergency, and this is what our plan of action is. It's like, oh well. What do you mean, oh well? It's not oh well. This is killing people. This is a disease that kills people, that debilitates people, that makes people very sick, and gives them Alzheimer's disease. Because like I said, there is no such thing as Alzheimer's disease. It's an infection with an organism, usually more than one.
Yeah, and Dr. Alan McDonald, pathologist, I'm sure you've seen his work, autopsying brains of Parkinson's. He's been able to grow a spirochete out of every single one of those brains.
Right, 100 out of 100 autopsies brains, he's been able to demonstrate the Borrelia in the amyloid plaques. And he's being ignored because, it doesn't fit in with our reality, or the matrixed reality that we live under here in the United States.
So if the medical system is, we just call it the Rockefeller system, it's the patented drugs, where obviously you've been not in that world, not wanting to work in that world or be part of that. So talk to me about your world. What is a better path for people for healing and health? Hyperbaric oxygen therapy.
Well, yes, I mean, there are therapies out there. There's always alternatives. And for example, you mentioned hyperbaric oxygen therapy, which is one of the things I do. In the case of Lyme disease, This is a facultative anaerobe, so it cannot tolerate high levels of oxygen. And when you put somebody under pressure and you give them 100% oxygen, you will kill this organism without antibiotics even. I mean, the oxygen's acting as an antibiotic in a sense for doing this. So that's a non-invasive, humanitarian, drug-free way of treating at least the Borrelia part of the infection. Now,
and that's going to affect the whole body, including brain.
Right. It's good for the whole body, but it's not a therapy that is accessible to most people. So my chamber is the only freestanding chamber on the entire San Francisco Peninsula. When I say freestanding, it means that yes, there's a hyperbaric chamber at the hospital, but they just treat diabetic foot wounds with it. Mm-hmm. They're not going to treat Lyme disease patients with it. So,
and there's a big difference between your chamber, which we'll see if we can put on this video as well too, so people can see at least what it looks like. But there's a difference between your chamber and a chamber that they would buy for at home.
In terms of Lyme disease, because you do need high pressures, the portable chambers, which get up to about 1.3 atmospheres of compressed room air, are very therapeutic for brain healing.
Okay.
But there's certain things
like post-stroke,
cerebral palsy, autism, traumatic brain injury. But there's certain things that they're just not cut out for. You can't treat gas gangrene with them, decompression sickness, or Lyme disease. Those require higher pressures.
Okay. So what was the atmospheric pressure of portable ones for at home?
Just under 1.3 atmospheres.
1.3, and what will yours go up to?
I will take Lyme patients to 60 feet below seawater pressure, which is about 2.8 atmospheres.
Wow. Okay. So there's a pretty big difference then for at home.
Yes.
Do you find, what's your opinion on mold? So obviously, Lyme is a living toxin, biotoxin, biological toxin. Mold will fall in that category. What's the effect of hyperbaric with mold toxicity?
Well, a lot of molds will not tolerate high levels of oxygen either.
Okay.
And the nice thing about hyperbaric oxygen is it improves your immune system. So even if you don't really know what you have, by improving your immune system, your body's able to deal with it better. So for example, in England, hyperbaric oxygen chambers are the primary treatment by MS patients for MS patients.
Really?
There are over 60 charity centers in England that will treat multiple sclerosis patients without charging them. It's a very nice program. Now, they don't exactly know what they're treating. A lot of patients who are diagnosed with MS actually have Lyme disease. And the ones that don't have Lyme disease usually have a retrovirus. So that if MS can be treated with some of the medicines that are used for treating HIV positive patients, you would see improvements. But that research, that knowledge is not filtering into the clinical practice of medicine. So while the hyperbaric chambers in the United Kingdom don't cure MS, they certainly make those patients feel better and change the clinical course of their illness, because if you have a virus infection and your immune system is functioning better, guess what? You're less sick.
And get better. So Lyme, what are the different conditions that you would say mimic Lyme? Alzheimer's is something, MS?
Well, it's like Lyme mimics everything.
Okay.
I mean, when you have a Lyme patient, they could come in with Hashimoto's thyroiditis. They have thyroid problems. They often have heavy metal toxicity because especially if you've had the Borrelia infection for a long time, it takes its toll on your detoxification kinetics in your immune system. So you start collecting all these poisons, and sometimes you have mold that fungal infections you're dealing with. So very few people, unless they've been recently bitten, just come in with a Borrelia infection. They come in with a whole boatload of problems.
Which makes sense. So in other words, I look at it, at least in my mind, I believe what you're saying, when you have Lyme, the Borrelia bacteria, spirochete, it will clog up lymphatic system, it'll clog up just movement, and then that's where you get exposed to something, you can't clear it, so it just kind of accumulates?
Right.
Okay. Talk to me about your book, Incurable Me.
Incurable Me as a very...
Available on Amazon.
Right. It's a very deceiving title, Why the Best Medical Research Doesn't Make It into Clinical Practice. But it starts off talking about this global pandemic of Lyme disease and the politics, but it also talks about how you get diagnosed, how you get treated. I review my protocol, the one I use on most of my patients.
Okay.
Not to tell people to treat themselves, but at least they should know what to be looking for in getting treated for this and getting diagnosed with it. And then I start talking about dementia, which is another big problem that's not understood. And of course, I've already said that Alzheimer's disease is really Lyme disease as well. And insecticides, because so many of our problems are related to the pesticides we're exposed to. And for example, most people think that DDT is banned in the United States. It wasn't. In 1972, there was a general use ban, but there was another insecticide called diclofol. In fact, chapter 2 of my book is, Are We All Getting Diclofoled? Okay? Because diclofol is DDT with just a little hydroxyl group attached to it. That isn't banned. That isn't even part of the Stockholm Convention.
And continuing to be used.
And continued to be used.
Wow.
And a few years ago, the World Health Organization just basically told Africa to use DDT with abandon, to control malaria. And I'm not a big fan of malaria, but using DDT to control malaria is not sustainable. It's very expensive, which is good for the people who are making the DDT, but you're never going to control it that way. And these persistent pollutants, these organochlorine pesticides, are causing cases of polio. But polio is caused by the polio virus. No, it's not. If the polio virus and that entire family of virus, enteroviruses, if there is not a co-toxicant involved, that virus will not cause paralysis. So, for example, in India, in 2011, they patted themselves on the back. We've eradicated the polio virus, completely ignoring that their cases of non-polio acute flaccid paralysis have gone through the roof. So it's like we got rid of the fly, but we didn't, deal with the fact that there's rotting sewer in the running right through the house. So,
and isn't there an extreme amount of pesticide use in
right,
that?
so India uses a lot of DDT.
Okay.
And it's not on anyone's radar that you have to stop using the DDT. The DDT was the cause of the polio outbreaks in the last century. I mean, it started out because of the pesticide lead arsenate. But, after World War II, and the DDT was used with abandon, and that was what the polio outbreak was about. So you still have these outbreaks of non-polio acute flaccid paralysis breaking out in the United States due to non-polio enteroviruses. But like I said, if the virus isn't present with the pesticide, you don't get the paralysis. It's a rather benign. Enteroviruses are a relatively benign family of viruses unless they find a body that's been poisoned by the pesticides.
Yeah, which goes back to your comment, environmental toxicity.
And atrazine, that's been used, an incredible estrogen analog. So you have girls that are going into puberty at a much earlier age. You have men that are complaining of low T. I even think there's a possibility that's affecting people's sexuality. You're just polluting the entire environment with very strong estrogen analogs. And they're not getting regulated. It's like these companies are too powerful, and we're just going to have to live with it. They're indispensable. They're not indispensable. And until we take our power back as a society and say, you cannot do this. We cannot have the people who control the seed also control pesticides. Yeah. They cannot be the same people. We can make that happen, and that's what has to happen.
So in other words, supporting people and organizations that don't use pesticides is an important thing. Eating organic basically means that you're not, it's not 100% because there's obviously cross-contamination and things like that, but organic basically means that they're not using pesticides like the DDT or these other chemicals.
Right. I mean, we have a government that refuses to completely admit that the bees are disappearing because of pesticides. Well, we know they have some role in it, but, the definitive proof is not in yet. I mean, do you have to get hit over the head with a baseball bat? They do, because they're getting paid.
Yeah.
If someone is paying you, I think people would sell their mothers to the glue factory if the price was right. So the government has been bought and sold. These agencies are compromised, and it's dangerous because, like the CDC, when they say something, they have the power of law behind them. They can make things happen. But the CDC was founded to get rid of malaria. Good job, CDC. They haven't gotten rid of malaria. Malaria is still out there. So
I didn't even realize that.
Yeah, well, where's the vaccine for malaria? Well, there isn't one because they would know it wouldn't work. Okay, some of these other diseases, because a lot of the infectious diseases we're exposed to, their numbers collapsed because of good sanitation, good sewer system, a public that was getting, well fed. But if you really have to prove yourself, okay, where's your malaria vaccine? Guess what? Vaccines really don't work that well for a lot of illnesses. All the money and research for Lyme disease has been going into vaccine. It doesn't fit the vaccine model, okay? So for a disease to fit a vaccine model, the antibodies created by the vaccine need to either cure you of that bacteria or prevent an illness, even though you are infected with that bacteria. Talk to any Lyme disease patient, it doesn't matter how many antibodies they have to Lyme. They're not going to be cured or feel better. I mean, why isn't there a syphilis vaccine, for God's sake? It doesn't matter how many antibodies you have to syphilis. You're not going to get rid of it by yourself without an antibiotic.
Well, they came out with the Lyme vaccine, which they...
Well, it's very interesting. It's very interesting what happened. 15 years ago, they came out with the Lyme-Rix vaccine. Now, the vaccine was surface antigen A. So it was one of the proteins on the surface of the organism. The first people who lined up for this vaccine were people who previously had Lyme disease and didn't want to get it again. All right? So what happened was they got injected with surface antigen A. Guess what happened? They got very, very sick.
Flared it back up?
Because they never got rid of their infection, because this organism leaves persister cells. They're asleep. They're the undead. And when those persister cells detected there was surface antigen A in that body, they said, someone's throwing a Lyme party and didn't invite us. And it woke up their sleeping Lyme disease infection. And they got their Lyme symptoms all over again because they got injected. I wish they hadn't gotten rid of that vaccine, because if they still had that vaccine today, we could use it to detect whether we've actually cured somebody. Because, you're done with your treatment, you're not having symptoms anymore, let's inject you with surface antigen A to see if you have any persister cells that will wake up. So it's a tool I wish we actually still had, not because it's a vaccine, it would protect, but it would be a way of seeing if we could provoke a die-off reaction or, to see if we could wake up persister cells. Because you want to wake up persister cells so you can kill them.
Yes.
But while they're torpid, while they're asleep, you can't kill them because they're metabolically inert. So I actually wish that product was still available, but it's not. Not for the reasons that,
Yeah. So define persister cell to me, because when I think about Lyme disease, I think about the spirochete, the spiral form. You hear of like the L form, but now they're saying it's not really an L form, it's more a round body or a cyst type form. Then you have this intracellular form, and then some people, talk about the biofilm. Where does persister cells fit into that?
So there's 2 rate-limiting steps in getting rid of these Borrelia infections. One is the biofilm, and I found this drug called Alinea that is just wonderful at ripping apart biofilm.
Okay.
I think 30% of infected patients could get rid of their Lyme disease with just that one drug alone, assuming they don't have any co-infections. But I don't know, there's no way of knowing, are you a member of the 30%? So I use other drugs as well. The other rate-limiting step are these persister cells. So Lyme is not the only organism that leaves persister cells or uses persister cells. You have to pulse your antibiotics. So at a certain point, you go off of your therapy and give a certain amount of time for these persister cells to wake up, presumably because they're not going to wake up if you've got a lot of antibiotics circulating through your body. They'll stay hidden and asleep. Right. And then if your symptoms start to flare up again, you hit them hard with the antibiotic protocol. Or you just pick a time, let's say 3 weeks, and you do a pulse of antibiotics then. If you don't notice anything, maybe you don't have any persistent. Like I said, I wish there was a way of testing. The situation, and it's too complicated for our discussion here, but Lyme testing is really an indirect process. It's looking for antibody levels.
Yes.
And the reason why that's a problem is the Lyme organism suppresses your immune system. So the sickest patients may have the weakest levels of antibodies. And the testing procedure itself is problematic because the Borrelia break off into 2 groups. The Burgdorferi group, which is the one that's recognized for causing Lyme disease, and the relapsing fever group. The relapsing fever group is not going to test positive on the Western blot. And for example, in the San Francisco Bay Area where we are now, 40% of the infected ticks actually have an organism called Borrelia miyamotoi. That's in the relapsing fever group. You're not going to test positive on the Lyme Western blot if you have that infection. You also have to be doing Western blot for the relapsing fever group. There is a direct test. It's called the PCR polymerase chain reaction test that looks for the DNA of the organism. Now, this is not recognized by the CDC as diagnostic, but who cares what the CDC has to say? The problem is it has a 70% false negative rate because these Borrelia, these bacteria, don't really like to hang out in people's bloodstream. They like to avoid oxygen if possible. So if you have 10 bona fide Lyme disease patients, you're only going to find the DNA in about 3 of them.
Okay.
So, and then you can't use that test as an outcome measure. I mean, it's great if you if you find the DNA. That's like catching the golden snitch in Harry Potter's Quidditch. It doesn't matter what the score was with, the rest of the game. The problem is you could repeat that test 2 weeks later and not find the DNA, even if you haven't done anything to cure yourself, because there was a 70% chance the next time you weren't going to find it. So we can't use that test as an outcome measure. It's not cost effective to do that test for that reason. I mean, if it was a free test, I'd tell everybody go ahead and do it, but it's not a free test. So that's the problem with the testing. We were relying on these indirect antibody levels, and the sicker you are, the lower your antibodies get, and until you're seronegative, as it's called. So some of the sickest people are seronegative, never mind the relapsing fever group, which is another complication because they're never going to test positive on the Western blot that's designed to detect the Burgdorferi group.
Let alone this immune suppression within the whole.
Exactly. And most people don't know that Lyme disease is an STD. I mean, it may not transmit as much as syphilis does. I mean, if you're having sex with someone who has syphilis, you're going to get syphilis every time. That's not the case with Lyme disease, but nobody knows exactly what the percentage of transmission that way is. And you can get it congenitally, so the mother can pass it to the fetus depending on what stage she's going through of Lyme disease, because this organism has various stages that it goes through. And this level of detail that I'm talking to you about with Lyme disease is problematic because most physicians are brainwashed to think this is a very rare disease, it's limited to a few geographical areas, and it's very easy to detect. It's very hard to detect it in the lab. It's all over the place. Now, yes, the chances of getting Lyme disease in the Mojave Desert is a lot less than in the Muir Woods. Mm-hmm. So there are areas that have a higher risk of getting this disease. But it's all over the United States. It's all over the globe. There are areas in India where they've measured the 18% seropositive rate amongst the population for Lyme disease.
Wow.
You say Lyme disease in India, people are going, they don't even know what you're talking about. It's not on the radar. Yep. I mean, you have countries like Australia. It's been 25 years since entomologists announced in publications that 40% of the ticks have Borrelia in their guts. Lyme disease doesn't exist in Australia, mate. That's from somewhere else. No, it's not. They've got Lyme disease. Total denial about it. What's that about? Boy, the brainwashing is good.
Well, I'm glad you brought that up because I think about when the CDC a few years ago and they said 300,000 or 330,000, it was looking at 13 states. And my brain's like, Lyme doesn't know a border. Lyme doesn't, it can be carried by birds to other continents, to other countries. It doesn't know a border. So to say and still have people, literally, just in about a month ago, I had a client in Texas. She said, "Oh, my doctor said that Lyme disease doesn't exist in Texas."
Mm-hmm. Just X's. In my book, I have a map of the states that had the most schizophrenia,
okay,
and a map of the states that have the most Lyme disease. Guess what? It's almost the same map. Scary, isn't it?
It makes you think differently. Schizophrenia, Lyme.
A lot of cases of schizophrenia are an infection. And I'm not just saying it's Lyme disease. I don't want to sound like a broken record. Toxoplasmosis gondii, which is a protozoa, is responsible for plenty of cases of schizophrenia.
Okay.
So,
which is where you say basically brain conditions or brain diagnoses, you want to look at infection.
Rule out infection, but you have to know what you're looking for.
Okay.
Okay, you have to know what test to do. You have to know how to read the test. Just because you get something come back negative, that doesn't mean you don't have the infection. You have to look deeper. You have to turn over more rocks.
Okay.
It's too even if physicians suddenly magically embraced and said, "Mea culpa, we were unaware of this pandemic," they would be clueless about how to really understand how to diagnose this and how to treat it. Because this is just not, this is the global negation of an illness. This is beyond Nuremberg trial offense. This is some very disturbing stuff. Not as disturbing as spraying pesticides all over the place and not acknowledging that you're poisoning people and killing people. Look what's happened to the Zika virus. Those microcephaly cases are localized to a northeastern part of Brazil, where they were injecting the host cell DTaP into pregnant women in combination with having them drink larvicide in their tap water. Okay? That combination, the disturbing of the immune system from the vaccine,
yep,
and the pesticide together, that's what caused the microcephaly. There's no microcephaly in Puerto Rico. They're reporting 1,000 new cases a week. Okay, there's no microcephaly in Colombia. There's no great outbreak of microcephaly in Polynesia. All these places have had massive Zika outbreaks. This is about wealth transfer. Scare the public, scare the government, send the money to the vaccine manufacturers and the Centers for Disease Control. This is robbery, and they're scaring people to get money. Meanwhile, there's a real pandemic, and it's being ignored. So this is some sick stuff. This is sick.
Which is really why I wanted to interview you, to get the unedited version of what's going on, because people need to know about this, and they need to open their eyes to it. So coming back to your book title, Incurable Me, you're basically saying that based on, I mean, where does the title come from? Does it come from the fact that you aren't curable by the traditional medical system?
Right,
Okay.
right. And it's a catchy title, let's face it.
Yes, yeah.
So, all right, so you have celebrities like Chris Christopherson and Joni Mitchell. I'm sure Robin Williams had Lyme disease, and he never got diagnosed. I mean, he grew up in Woodacre and Marin, went to Mill Valley High School, College of Marin. If he didn't have Lyme disease, no one has had Lyme disease. So you can see, looking at Chris Christopherson, Joni Mitchell, Robin Williams, just a window of how devastating this infection is. And most people, I mean, 90% of people with tuberculosis are asymptomatic. They don't have symptoms at that moment.
Yeah.
But Lyme disease will get you sooner or later, you know, even if that just means Alzheimer's disease. Who wants Alzheimer's disease, though? You know, once your brain turns to jello, it's a little late to, you know, walk back a 40-year-old infection.
Yeah. Well, it makes so much sense when you look at Lyme, too, because it seems as if mold exposures or big physical traumas like a car accident or emotional traumas, losing a loved one, all of a sudden trigger it, which means it was probably there, and then immune system got suppressed and...
So people are walking this razor's edge with their immune system. Something pushes them over, and then they're devastated. You know, where did this come from? You know, and they think this is it for them. You know, and it was all just because they had this infection that they were masking for a while. And you know, the infamous bullseye rash that people get with Lyme disease, I always wondered why that was IgG antibodies causing the rash. Why would somebody who doesn't have an illness have IgG antibodies to that? Because the IgG antibodies are the convalescing chronic antibodies. What are people doing with chronic antibodies for an infection they just got? Well, guess what? The people who get the bullseye rash are people who probably already had Lyme disease.
Which means then they're not in the acute phase.
That's right. They're already in
Wow.
the chronic phase, and that's why only about 20% of people get the bullseye rash, because that's the penetration, that's my guess, that's the penetration of this infection in the population, 20%.
Wow.
Does that make sense?
Oh, yeah. My brain's stirring right now because you just put pieces together for me.
So, no, you didn't get a bullseye rash, don't worry about it. No. The people who get the bullseye rash are already infected.
Wow.
And then they get treated by, 2 weeks of a single antibiotic from their Kaiser doctor? Please. That's not going to help them.
If that's not something to think about right there, wow. Well, I want to thank you, Dr. Stoller, for allowing me to come up to San Francisco to interview you. Drive to the other side of the state, but definitely worth it to chat with you and make sure to get your message out there. You've got a brand new book that's out any day now. If it's not yet, it's called Incurable Me. So you can get it on Amazon, correct?
You can get it right today. You can get it on Amazon.
Okay. So Incurable Me. You can also check out, he's got a couple websites, incurable-me.com. And then also the other one is HBOT, HBOTSF, which stands for San Francisco, HBOTSF.org, correct?
Correct.
Awesome. So definitely check that out and look forward to possibly even interviewing him in the future as well. So I really want to thank you for your time.
You're
today.
welcome. Sorry if I gave anybody nightmares. I didn't mean to.
There is hope. Continue learning. It's all about putting the pieces together. So we'll see you on the next podcast.
Thank you for listening. If you enjoyed this episode or found it valuable, please leave positive feedback, as it will get the message out to those searching for answers to their health issues. You can find more information and resources at drjdavidson.com. That's DRJAY Davidson.com. drjdavidson.com.